role of a financial counselor here at the center is to help a patient navigate through their insurance obstacles that may arise during their treatment and their testing components of the process. A financial counselor will help a patient review what their benefit coverage is, assisting you in obtaining prior authorizations. If the insurance companies deny services, we're there to help with the appeals process and to help maintain a balance between you and your insurance company, and at the same time just being there to help you begin the process of infertility treatments, and also discuss any potential financial responsibilities a patient may have throughout their cycle. A patient can optimize their visit with a financial counselor by phoning their insurance companies beforehand, making that initial phone call to their insurance, and just obtaining the general information of what their infertility benefit is. We encourage patients to write down the person that they speak to, as well as a reference number to help document the telephone call. The financial counselors do reach out to the insurance company prior to a patient coming in as a new patient. And the reason why we do that is so that we can kind of get a general overview of what the patient has for insurance coverage. And at the first visit, what we will do is we'll sit down with the patients and we'll kind of compare notes, and just to see whether or not the information is matching. And if the information is matching, then basically what we'll do is, depending on what the physician is recommending for testing, we'll then reach out to the insurance company again just to ensure if there's any authorizations and any of that process is required. Part of the prior authorization process for treatment, a financial counselor will then contact the insurance company, the prior authorization department, obtain any authorizations. If there's any out-of-pocket expenses at that time, once we receive the information directly from the insurance company, we'll then sit down and itemize that information for a patient so that they know potentially what the expenses are going to be prior to them rendering services here at the center. When a patient presents to the office, and if they've made the initial phone call with their insurance company, by us communicating and just comparing our notes will help ensure that we're both on the same page and we do have the same information, and we can move forward. If there's a discrepancy from what the patient is told and what the financial counselor is told, at that point we'll stop and make another phone call, and that'll help us ensure the information that we do obtain in the future is correct. Patients can assist us, the financial counselors, in keeping us up to date with different types of situations that may occur during their treatment cycles, touching base with their financial counselors if there are any changes, any additions or subtractions to their protocols. These are little simple things that can truly make an impact on their insurance piece and financial piece of all of their treatments here at the center. Insurance companies do cover infertility treatments. The amount of coverage is determined by what the employer has elected for benefits. However, Connecticut is a state-mandated state now since October of 2005, so that has helped patients obtain additional coverage. And since January of last year, 2016, the state has increased the age and uplifted the age restrictions. That has also helped patients in moving forward with their infertility treatment. So essentially, it's really up to the employers to identify and dictate what a patient's potential coverage is for infertility. So unfortunately, if we have 5 patients with the same insurance company, all 5 patients can have different type of insurance coverage. It really depends on what the employer selected for their benefit package. Yes, there are some financial programs that do assist with patients. There's the Nest Egg Foundation. That is a grant-funded foundation that a patient can, with their primary infertility, they can submit an application, and depending on the number of applicants and the funds that they have, will allow patients the opportunity to have a significant amount of their IVF coverage covered. There's also some wonderful medication companies that will actually offer patients the ability to access medications at a discounted rate. We also offer a loan company called CapXMD that does loans for patients at low interest rates. For patients that don't have any insurance coverage or have maxed out their infertility benefits, here at the center we offer IVF possibility plans. And with the possibility plans, it allows patients to seek infertility services at discounted rates. In addition to that, there are foundations that are set up, such as the Nest Egg Foundation. It is a Connecticut-based program for patients with primary infertility who may be able to seek some form of grant monies to help them assist with their infertility services. There's also independent loan companies that will offer loans to our patients. Some of the other programs here at the center that we offer is what we call the IVF Financial Share Program. It's a program set up for multiple IVF cycles at a discounted rate. The other option is for military patients. For veterans, active military, there's also wonderful discount programs associated with that type of treatment. For patients that need assistance with medication expenses, we also offer different types of programs such as Design RX, Compassionate Care Program, Compassionate Corpse Program. These are all medication programs that are set up for patients who have financial struggles or who can just qualify for discounted medications, being the fact that they have no insurance coverage. Financial counselors offer assistance to patients to help them guide and navigate through their journey of infertility. We help a patient by accessing benefit information, by obtaining authorizations, and trying to help figure out what the potential out-of-pocket expenses will be for a patient with their medical services here at the center. We strongly believe in developing partnerships with our patients. By working together, we can help alleviate the stress that the financial aspects and the insurance aspects can impact on a patient's infertility cycle.